The client with Cushing's disease. Question. The patient with Cushing's disease needs to modify dietary intake to control symptoms. In addition to increasing protein, which strategy would be most appropriate? A. Restrict potassium. B. Reduce fat to 10%. C. Increase calories. D. Restrict sodium. Answer. Choice D is correct. Explanation. A primary dietary intervention is to restrict sodium, thereby reducing fluid retention. Increased protein catabolism results in loss of muscle mass and necessitates supplemental protein intake. The patient may be asked to restrict total calories to reduce weight. The patient should be encouraged to eat potassium-rich foods because serum levels are typically depleted. Although reducing fat intake as part of an overall plan to restrict calories is appropriate, fat intake of less than 20% of total calories is not recommended. Question. Bone resorption is a possible complication of Cushing's disease. Which of the following interventions should the RN recommend to help the client prevent this complication? A. Increase the amount of potassium in the diet. B. Limit dietary vitamin D intake. C. Maintain a regular program of weight-bearing exercise. D. Perform isometric exercises. Answer. Choice C is correct. Explanation. Osteoporosis is a serious outcome of prolonged cortisol excess because calcium is resorbed out of the bone. Regular daily weight-bearing exercise, e.g., brisk walking, is an effective way to drive calcium back into the bones. The patient should also be instructed to have a dietary or supplemental intake of calcium of 1,500 mg daily. Potassium levels are not relevant to prevention of bone resorption. Vitamin D is needed to aid in the absorption of calcium. Isometric exercises condition muscle tone but do not build bones. Question. A patient has an adrenal tumor and is scheduled for a bilateral adrenalectomy. During preoperative teaching, the nurse teaches the patient how to do deep breathing exercises after surgery by telling the client to A. Sit in an upright position and take a deep breath. B. Hold your abdomen firmly with a pillow and take several deep breaths. C. Raise your shoulders to expand your chest. D. Tighten your stomach muscles as you inhale and breathe normally. Answer. Choice B is correct. Explanation. Effective splinting for a high incision reduces stress on the incision line, decreases pain, and increases the patient's ability to deep breathe effectively. Deep breathing should be done hourly by the client after surgery. Sitting upright ignores the need to splint the incision to prevent pain. Tightening the stomach muscles is not an effective strategy for promoting deep breathing. Raising the shoulders is not a feature of deep breathing exercises. Question. What is the priority in the first 24 hours after a bilateral adrenalectomy? A. Beginning oral nutrition. B. Promoting self-care activities. C. Ambulating in the hallway. D. Preventing adrenal crisis. Answer. Choice D is correct. Explanation. The priority in the first 24 hours after adrenalectomy is to identify and prevent adrenal crisis. Monitoring of vital signs is the most important evaluation measure. Hypotension, tachycardia, orthostatic hypotension, and arrhythmias can be indicators of pending vascular collapse and hypovolemic shock that can occur with adrenal crisis. Beginning oral nutrition is important, but not necessarily in the first 24 hours after surgery, and it is not more important than preventing adrenal crisis. Promoting self-care activities is not as important as preventing adrenal crisis. Ambulating in the hallway is not a priority in the first 24 hours after adrenalectomy. Question. A patient undergoing a bilateral adrenalectomy has postoperative prescriptions for hydromorphone hydrochloride, Dilaudid 2 mg to be given subcutaneously every 4 hours as needed for pain. This drug is administered in relatively small doses primarily because it is A. Less likely to cause dependency in small doses. B. Less irritating to subcutaneous tissues in small doses. C. Excreted before accumulating in toxic amounts in the body. D. As potent as most other analgesics in larger doses. Answer. Choice D is correct. Explanation. Hydromorphone hydrochloride, Dilaudid, is about 5 times more potent than morphine sulfate, from which it is prepared. Therefore, It is administered only in small doses. Hydromorphone hydrochloride can cause dependency in any dose, however, fear of dependency developing in the postoperative period is unwarranted. The dose is determined by the patient's need for pain relief. Hydromorphone hydrochloride is not irritating. Question. A patient report that she has gained weight and that her face and body are rounder, while her legs and arms have become thinner. A tentative diagnosis of Cushing's disease is made. The RN should further assess the client for A. Muscle hypertrophy in the extremities. B. Orthostatic hypotension. C. Bruised areas on the skin. D. Decreased body hair. Answer. Choice C is correct. Explanation. Skin bruising from increased skin and blood vessel fragility is a classic sign of Cushing's disease. Hyperpigmentation and bruising are caused by the hypersecretion of glucocorticoids. Fluid retention causes hypertension, not hypotension. Muscle wasting occurs in the extremities. Hair on the head thins while body hair increases. Question. A patient diagnosed with Cushing's syndrome is admitted to the emergency and scheduled for a dexamethasone suppression test. During this test, the nurse should A. Administer an injection of adrenocorticotropic hormone ACTH 30 minutes before drawing blood to measure serum cortisol levels. B. Collect a 24-hour urine specimen to measure serum cortisol levels. C. Administer 1 mg of dexamethasone orally at night and obtain serum cortisol levels the next morning. D. Draw blood samples before and after exercise to evaluate the effect of exercise on serum cortisol levels. Answer. Choice C is correct. Explanation. When Cushing's syndrome is suspected, a 24-hour urine collection for free cortisol is performed. Levels of 50 to 100 meters Cg per day 1379 to 2756 nmol per liter in adult patient indicate Cushing's syndrome. If these results are borderline, a high-dose dexamethasone suppression test is done. The dexamethasone is given at 11 p.m. to suppress secretion of the corticotrophine-releasing hormone. A plasma cortisol sample is drawn at 8 a.m. Normal cortisol level less than 5 mg per dl 140 nmol per liter indicates normal adrenal response. Question. The RN should monitor the client with Cushing's disease for which of the following? A. Postprandial hypoglycemia. B. Hypokalemia. C. Decreased urine calcium level. D. Hyponatremia. Answer. Choice B is correct. Explanation. Sodium retention is typically accompanied by potassium depletion. Hypertension, hypokalemia, edema, and heart failure may result from the hypersecretion of aldosterone. The patient with Cushing's disease exhibits postprandial or persistent hyperglycemia. Patients with Cushing's disease have hypernatremia, not hyponatremia. Bone resorption of calcium increases the urine calcium level. Question. A patient with Cushing's disease tells the nurse that the physician said the morning serum cortisol level was within normal limits. The client asks, "How can that be? I'm not imagining all these symptoms." The nurse's response will be based on which of the following concepts? A. A single random blood test cannot provide reliable information about endocrine levels. B. Some clients are very sensitive to the effects of cortisol and develop symptoms even with normal levels. C. The excessive cortisol levels seen in Cushing's disease commonly result from loss of the normal diurnal secretion pattern. D. Tumors tend to secrete hormones irregularly, and the hormones are generally not present in the blood. Answer. Choice C is correct. Explanation. Cushing's disease is commonly caused by loss of the diurnal cortisol secretion pattern. The patient's random morning cortisol level may be within normal limits, but secretion continues at that level throughout the entire day. Cortisol levels should normally decrease after the morning peak. Analysis of a 24-hour urine specimen is often useful in identifying the cumulative excess. Patients will not have symptoms with normal cortisol levels. Hormones are present in the blood. Question. The RN is caring for a patient who is scheduled for an adrenalectomy. Which of the following drugs may be included in the preoperative prescriptions to prevent Addison's crisis following surgery? A. Fludrocortisone subcutaneously. B. Prednisone orally. C. Spironolactone intramuscularly. D-methylprednisolone sodium succinate intravenously. Answer. Choice D is correct. Explanation. A glucocorticoid preparation will be administered intravenously or intramuscularly in the immediate preoperative period to a patient scheduled for an adrenalectomy. Methylprednisolone sodium succinate protects the patient from developing acute adrenal insufficiency, Addison's crisis, that occurs as a result of the adrenalectomy. Spironolactone is a potassium-sparing diuretic. Prednisone is an oral corticosteroid. Fludrocortisone is a mineral corticoid. Question. Adrenal function is affected by the drug Ketoconazole, Nizoral. How is this effect manifested? A. Ketoconazole destroys adrenocortical cells, resulting in a medical adrenalectomy. B. Ketoconazole increases adrenocorticotropic hormone ACTH-induced corticosteroid serum levels. C. Ketoconazole decreases duration of adrenal suppression when administered with corticosteroids. D. Ketoconazole suppresses adrenal steroid secretion. Answer. Choice D is correct. Explanation. Ketoconazole, Nizoral, suppresses adrenal steroid secretion and may cause acute hypoadrenalism. The adverse effect should reverse when the drug is discontinued. Ketoconazole does not destroy adrenal cells. Mitotain, lysidrin, destroys the cells and may be used to obtain a medical adrenalectomy. Ketoconazole decreases, not increases, ACTH-induced serum corticosteroid levels. It increases the duration of adrenal suppression when given with steroids therapy. Question. In the early postoperative period after a bilateral adrenalectomy, the patient has an increased temperature. The RN should assess the client further for signs of A. Dehydration. B. Poor lung expansion. C. Urinary tract infection. D. Wound infection. Answer. Choice B is correct. Explanation. Poor lung expansion from bed rest, pain, and retained anesthesia is a common cause of slight postoperative temperature elevation. The nursing care includes turning the patient and having the patient cough and deep breathe every 1 to 2 hours, or more frequently as prescribed. The patient will have postoperative IV fluid replacement prescribed to prevent dehydration. Wound infections typically appear 4 to 7 days after surgery. Urinary tract infections would not be typical with this surgery. Question. A patient who is recovering from a bilateral adrenalectomy has a patient-controlled analgesia system with morphine sulfate. Which of the following actions is a priority nursing intervention for the client? A. Encouraging the client to reduce analgesic use and tolerate the pain. B. Evaluating pain control at least every 2 hours. C. Increasing the amount of morphine if the client does not administer the medication. D. Observing the client at regular intervals for opioid addiction. Answer. Choice B is correct. Explanation. Pain control should be evaluated at least every 2 hours for the patient with a PCA system. Addiction is not a common problem for the postoperative patient. A patient should not be encouraged to tolerate pain. In fact, other nursing actions besides PCA should be implemented to enhance the action of opioids. One of the purposes of PCA is for the patient to determine frequency of administering the medication. The RN should not interfere unless the patient is not obtaining pain relief. The RN should ensure that the patient is instructed on the use of the PCA control button and that the button is always within reach. Question. After surgery for bilateral adrenalectomy, the patient is kept on bed rest for several days to stabilize the body's need for steroids postoperatively. Which of the following exercises will be most effective for preparing a patient for ambulation after a period of bed rest? A. Alternately abducting and adducting the legs. B. Alternately flexing and extending the knees. C. Alternately stretching the Achilles tendons. D. Alternately flexing and relaxing the quadriceps femoris muscle. Answer. Choice D is correct. Explanation. Alternately flexing and relaxing the quadriceps femoris muscles helps prepare the client for ambulation. This exercise helps maintain the strength in the quadriceps, which is the major muscle group used when walking. The other exercises listed do not increase a patient's readiness for walking. Question. As the RN assists the postoperative client out of bed, the patient reports having gas pains in the abdomen. Which of the following is the most effective nursing intervention to relieve this discomfort? A. Encourage the client to ambulate. B. Insert a rectal tube. C. Encourage the client to drink carbonated liquids. D. Insert a nasogastric tube. Answer. Choice A is correct. Explanation. Decreased mobility is one of the most common causes of abdominal distension related to retained gas in the intestines. Peristalsis has been inhibited by general anesthesia, analgesics, and inactivity during the immediate postoperative period. Ambulation increases peristaltic activity and helps move gas. Walking prevents the need for a rectal tube, which is a more invasive procedure. A nasogastric tube is also a more invasive procedure and requires a physician's prescription. It is not a preferred treatment for gas postoperatively. Walking should prevent the need for further interventions. Carbonated liquids can increase gas formation. Question. Because of steroid excess after a bilateral adrenalectomy, the RN should assess the client for A. Embolia. B. Malnutrition. C. Postoperative confusion. D. Delayed wound healing. Answer. Choice D is correct. Explanation. Persistent cortisol excess undermines the collagen matrix of the skin, impairing wound healing. It also carries an increased risk of infection and of bleeding to the patient. The wound should be observed and documentation performed regarding the status of healing. Confusion and embolia are not expected complications after adrenalectomy. Malnutrition also is not an expected complication after adrenalectomy. Nutritional status should be regained postoperatively. Question. The patient who has undergone a bilateral adrenalectomy is concerned about persistent body changes and unpredictable moods. The RN should tell the client that A. The body changes are permanent and the client will not be the same as before this condition. B. The body and mood will gradually return to normal. C. The physical changes are temporary, but the mood swings are permanent. D. The physical changes are permanent, but the mood swings will disappear. Answer. Choice B is correct. Explanation. As the body readjusts to normal cortisol levels, mood and physical changes will be gradually returned to a normal state. The body changes are not permanent, and the mood swings should level off. Question. After a bilateral adrenalectomy for Cushing's disease, the patient will receive periodic testosterone injections. The expected outcome of these injections is A. Restored sodium and potassium balance. B. Balanced reproductive cycle. C. Stimulated protein metabolism. D. Stabilized mood swings. Answer. Choice C is correct. Explanation. Testosterone is an androgen hormone that is responsible for protein metabolism as well as maintenance of secondary sexual characteristics, therefore, it is needed by both males and females. Removal of both adrenal glands necessitates replacement of glucocorticoids and androgens. Testosterone does not balance the reproductive cycle, stabilize mood swings, or restore sodium and potassium balance. Question. Which of the following should the RN include in the teaching plan of a female client with bilateral adrenalectomy? A. Emphasizing that the client will need steroid replacement for the rest of her life. B. Instructing the client about the importance of tapering steroid medication carefully to prevent crisis. C. Emphasizing that the client will need to take steroids whenever her life involves physical or emotional stress. D. Informing the client that steroids will be required only until her body can manufacture sufficient quantities. Answer. Choice A is correct. Explanation. Bilateral adrenalectomy requires lifelong adrenal hormone replacement therapy. If unilateral surgery is performed, most patients gradually re-establish a normal secretion pattern. The patient and family will require extensive teaching and support to maintain self-care management at home. Information on dosing, adverse effects, what to do if a dose is missed, and follow-up examinations is needed in the teaching plan. Although steroids are tapered when given for an intermittent or one-time problem, they are not discontinued when given to patients who have undergone bilateral adrenalectomy because the clients will not regain the ability to manufacture steroids. Steroids must be taken on a daily basis, not just during periods of physical or emotional. Thanks for watching. Subscribe and watch playlist for more videos.